Hello, everyone. Good morning, afternoon, evening, depending on wherever you are in the world. Welcome to day three, the final day of the RWEsearch and Health Innovation Summit 2025. Uh, it's been an power packed, action packed journey for the last 2 days in this event. We've gone through some incredible sessions on such a wide variety of topics in the last 2 days. We started the conference talking about the role of India in terms of innovating and transforming healthcare, both India for India and India for the world. We talked about how global capability centers in India are transforming healthcare across the world by providing scale, agility, and innovation. It's a different business model and it has helped move companies forward at a rapid pace. We talked about through the Ayushman Bharat digital mission, how healthcare transformation, probably the largest healthcare transformation in the world, is already underway. And so much progress has been made on these lines. We heard about the latest state of real world evidence adoption through a survey presented by Brett Davis and Jeff Morgan. Yesterday, again, was a power packed day. Uh, Through multiple panel discussions, we talked about the role of diversity in clinical trials, how some of the initiatives around this topic have panned out, what are some of the challenges, what are some of the successes achieved around the same. Uh, like all the panel said yesterday, it's not a question of if diversity is relevant or not. The only question is how to make it happen. And that's some very interesting discussions around the same. We also talked about fit for purpose data. We said that, large data, representative data are old concepts now. Now we also talk about relevant data, data that feeds well into AI and makes AI work. So fit for purpose data, how to validate data, lot of data versus AI ready data. What are some of the different aspects of it? There were some really good learnings coming out of it. This year, we also have collaborated, like you know, with eSport, which is one of the most premium bodies in terms of health outcomes, economics, and outcomes research. And in collaboration with them, we learned about what is real world evidence, the fundamentals of it, what are some of the latest initiatives that eSport is running, what are some of the avenues for learning about real world evidence, and how to participate. We also learned about their efforts around what they are doing for lower middle income countries to be represented in terms of the world of real world evidence. Um, we also heard from Sandeepan, who is the chair of their RWE Special Interest Group, about some of the latest innovations happening in the world of real world evidence, whether it is social determinants of health data and how they are making that relevant, or whether it is tokenization of real world evidence data, whether it is synthetic control arms and using them for trials, etc., etc. Uh, we partnered with our favorite partners, Real World Wednesdays, and had a live podcast episode as part of this conference. So much has happened now in last 2 days, and I cannot wait for day three to get started. Today, again, we have a full agenda. As a part of this conference, a month ago, our team initiated a hackathon for students to participate in and get a chance to work hands on real world data. It's something which students don't always easily get access to. We had 60 teams from probably 14 different institutions in India register for this event. All of them had exciting analysis done. Uh, the three winners or the best entries from the hackathon will be presenting live as a part of the conference. Apart from going deep into RWE topics, staying true to our mission of being very global, today we have two separate tracks. One track where we talk about the perspective in the Middle Eastern countries from an RWE standpoint and what is happening there, what is data readiness, what is AI readiness, what is the digital health innovation happening in Middle East. We also have a couple of panels focused on Africa, talking about different perspectives and learnings around bringing health transformation in Africa. What we are also doing is we're going to go deep into the topic of personalized cell therapy. This is a topic which I have learned a lot personally in last 1 year about. And as we learned about that, the fundamentals of what this treatment can do, how it can transform healthcare are limitless. So we thought that for the geeks and the doctors in the audience, this is something which could end up being very relevant. So we have Dr. Prithvi talk about that very shortly. Uh, Lastly, we also, from a innovation perspective, India has not only been doing a lot on the pharma side, but also on the medical device side. And as we think about research and health innovation on the device side, the topic of validation and verification is something which is taking a lot of center stage. We have a panel very specifically focused on next generation V&V techniques and what is happening in this area. So, as you look at the topics, it's kind of all very exciting, also very difficult to figure out which hall to be in because all these things are happening in parallel. Thankfully, we'll also have the recordings of the event accessible later for those who cannot be in two places at the same time. But with all that, I'll open up the floor, and very soon we'll have our first panel starting here in Hall A. So look forward to the exciting day 3 of this conference.